Hello there, I'm Monica Reinagel, and you are listening to the Nutrition Diva podcast, a show where we take a closer look at the latest nutrition research, headlines, and trends so that you can make more informed choices about what you eat. There has been a lot of news this year about GLP-1 receptor agonists as a treatment for obesity. And to be sure, this new class of medications has, in a very short period of time, completely revolutionized not only how we treat obesity, but even how we think about it. And with all of that buzz, it's easy to lose sight of the fact that these medications were originally developed as a treatment for type 2 diabetes. So today, in recognition of Diabetes Awareness Month, I'd like to take a closer look at how these medications have impacted how we think about and treat type 2 diabetes and the impact that they have had on individuals with this condition. Now, Diabetes Awareness Month covers all forms of diabetes, including type 1 diabetes, which is an autoimmune condition, and gestational diabetes, which affects pregnant women. And we won't be talking about those other types of diabetes today because GLPs have not been approved for use in those conditions. But you will find educational and advocacy resources for all types of diabetes at the American Diabetes Organization website, that's at diabetes.org, as well as the National Institute of Diabetes, Digestive, and Kidney Diseases. And we'll put links to both of those in the show notes for today. Before the advent of these GLP-1 receptor agonists, metformin was generally the first-line treatment for type 2 diabetes, and this is still the standard practice. Metformin works by reducing glucose production in the liver and also by improving insulin sensitivity, and it's a very effective medication and quite inexpensive, often just a few dollars per month. And the main side effects are gastrointestinal issues that usually resolve over time. But if metformin alone didn't do the trick, doctors would typically add sulfonylureas like glipizide or glyburide. These medications work by stimulating the pancreas to release more insulin. While these medications are also pretty inexpensive and effective at lowering blood sugar, they do have some drawbacks. Since they increase insulin secretion regardless of your actual blood sugar levels, they can lead to dangerously low blood sugar. And they can also lead to weight gain, which is often already a challenge for people who are managing type 2 diabetes. And lastly, there were drugs known as TZDs, thiazolidinediones, and these increase the body's sensitivity to insulin. Side effects for those meds include things like fluid retention and weight gain, and some were linked to heart issues and even bone fractures. So while these medications are effective, they each target just a single pathway, which means that you might have to layer on multiple medications. And they have side effects that can make other aspects of metabolic health worse. And this is why the GLP-1s have been such a breakthrough. GLP-1 receptor agonists, and this includes things like Ozempic, Rybelsus, and Trulicity, mimic a hormone that the body produces after you eat called GLP-1, which prompts the pancreas to release insulin when blood sugar is high and signals the liver to reduce glucose production. This dual action allows for steadier blood sugar levels without the ups and downs that can happen with other treatments. And in studies, GLP-1s have shown a significant ability to lower HbA1c. That's a key marker of long-term blood sugar control, making them highly effective for managing type 2 diabetes. But we now know that GLP-1 receptor agonists have benefits that go beyond blood sugar. One of the most notable side effects is weight loss. So, unlike some older diabetes medications that often lead to weight gain, GLP-1s tend to reduce your appetite. And that has helped many patients lose a meaningful amount of weight. And that's a big plus for people with type 2 diabetes because managing weight can play a very crucial role in controlling this condition. And as time has gone on, longer term studies have revealed that these medications also protect the heart and the kidneys. And this is particularly valuable because diabetes often puts those particular organs at risk. GLP-1s reduce the likelihood of serious cardiovascular events like heart attacks or strokes in patients who are at high risk of that. And most recently, GLP-1s were shown to help slow kidney damage. In other words, these GLP-1s are more than just blood sugar meds. They are now seen as powerful all-around tools for diabetes care, and this is likely going to transform how we think about managing this quite common disease. As exciting as all of this is, however, this remarkable breakthrough in diabetes care has been largely overshadowed by the discovery that these same medications could provide a powerful solution to the so-called obesity epidemic, which really upended some long-standing assumptions, narratives, and even biases around obesity. And the surge in demand for these drugs as obesity treatments has made it even more difficult for people with type 2 diabetes to access them. Remember, these medications are generally more expensive than the older diabetes drugs, leading to high out-of-pocket costs for many patients if your insurance even covers them. Medicare and other insurance plans often impose restriction, such as requiring that you get prior authorization or requiring that you try all the other options first. And in addition, biologic medications like GLP-1 receptor agonists are very complex to manufacture. And this, as I'm sure you've heard, has led to some serious supply issues. But even as we struggle to cope with all of these challenges, there are more breakthroughs in the pipeline. The next generation of GLP-1 based treatments includes dual action and even triple action drugs designed to target multiple metabolic pathways. And that's going to likely give them an even greater effect on blood sugar control, weight management, and overall metabolic health. One example of these is tirzepatide, a medication that activates both the GLP-1 receptor, but also a second receptor called GIP. And by activating both receptors, tirzepatide has shown even more significant impacts on both glucose control and also weight loss than the GLP-1 receptor agonists alone. We are clearly at the threshold of a very exciting future in which treatments for diabetes and obesity will be more comprehensive, tackling multiple aspects of those conditions with a single therapy. But as with the original GLP-1 medications, widespread access to these more advanced therapies is also going to depend on manufacturing capabilities and probably going to require some policy changes to improve insurance coverage. In the meantime, Diabetes Awareness Month gives us a great opportunity to refocus on just how transformative these advancements have been for diabetes care, offering benefits that older diabetes treatments just didn't offer. And there is also still a huge need for basic education and awareness around type 2 diabetes. An estimated 1 in 5 people with diabetes aren't aware that they have it. And more than 8 in 10 adults who have prediabetes remain undiagnosed. So this means that millions of people at risk for serious health complications are missing the chance to benefit from early intervention and effective treatment. So one of the goals of this health awareness campaign, Diabetes Awareness Month, is to encourage people who are at risk to get screened because early treatment can make all the difference in limiting the impact and the harms of this condition. So again, please check the show notes for more resources. And if you have a question you'd like me to answer, you can email it to me at nutrition@quickanddirtytips.com. You can also leave me a message at 443-961-6206. If you're looking for more support for healthy weight management options, please check out the tools and resources at wayless.life, where I help people create the habits, mindset, and lifestyle that help them weigh less without dieting. That's at wayless.life. Nutrition Diva is a quick and dirty tips podcast. Our team includes Brandon Getchis, Nathan Sems, Davina Tomlin, Holly Hutchings, Morgan Christensen, and Nate Hoops. Thanks for listening. I'll see you next week.